This video is mainly meant for how to do the PEG procedure for patients who are not taking orally for many weeks, like head injury patient in coma or bulbar nerve paralysis. For this patient, if we are giving the orally, this kind of patient will go for aspiration pneumonitis. For these kind of patient, very much useful to prevent the aspiration, and also we got support the nutrition. This is a very much useful procedure. Let's see the procedure. Now, after the local infiltration in the anterior abdominal wall and oral preparation, after entering the OGD scope through the mouth and enter the esophagus, visualize the stomach, anterior part of the stomach. Now insert the needle, that is a guide wire needle, through the anterior aspect of the percutaneously, enter into the lumen of the stomach. After identifying that needle is entered into the lumen of the stomach, confirmed by the endoscopic, then inserting the guide wire. Inserting the guide wire through the percutaneous cannula. Now you can see that the guide wire inserted through the cannula from the percutaneously. After entering the guide wire into the stomach, now through the OGD scope, grasper is inserted to grasp a guide wire. Now you can see that. The guide wire is come out through the cannula. Now with the grasper, now grasping the guide wire. Now after the grasping the guide wire, now pull out the guide wire through the mouth along with the OGD scope. Now you can, let's see that. Now this is a procedure, very important step. After the guide wire come out through the mouth, now we have to inserting the PEG tube, that is percutaneous endoscopy tube, through the guide wire. After putting the small knot over that, this is a procedure. After making the knot with the guide wire up, now let's see that. Now we have to pull out the guide wire from the percutaneously. Now inserting the PEG tube after the lubricant applied over the tip of the PEG tube. Now inserting through the mouth, it will enter into the stomach. Now come out through the percutaneously. Now after that, now we have to, let's see it. After that, guide wire is stuck to the anterior wall of the abdomen. After the cleaning, small incision is inserted. Small incision is make it over the percutaneously. For that, easily come out of the stomach tubes. We should not make the big incision, because there is after that come out through it, the leak will be there. Food container will be leaked through this very small incision. That incision enough to come out the PEG tube through the percutaneously. So now we have to inserting the PEG tube through the mouth and come out through the percutaneously. Now after that, we have to confirm it whether it is correctly placed in the stomach wall. We have to confirm it by again you are inserting the OGD scope through the mouth. Now you can see that after entering the mouth, it will enter into the stomach. You can see that the OGD scope is slowly entering into the stomach. You can see, yes. Now we can see that, yes. So we are able to see that, yes. So yes, very important step. The patient will struggling, very much important. We have to make the patient to calm and reassurance. Some patient need small IV sedation for comforters. Yes, now we are confirming that is a mushroom catheter tip correctly placed on the anterior wall of the stomach. That is a mushroom catheter. It is like you can see that this is a mushroom catheter tip. So correctly placed. Now we are confirming that is correctly placed in the entry wall of the stomach with the OGD scope. This yes. Now in some liquids are flushed through the tube. There is small liquid is come out through the tube. You have to confirm it correctly placed. The pattern of the tube is checked. We have to insufflate. Yes, very good, very good. This is how we have to insufflating the liquids and into the stomach. Now, yes, this is very much correctly placed. After that, we have to come to this inner one. This is the outer pumper. This outer pumper prevent the pec tube enter into the stomach over length. Then along with some knotted place to accidentally come out of the pec tube percutaneously. This will after that this is a lock. There is a red color. This is the lock placed in the pec tube to prevent the after giving the food particle will not return back to through the tube. This will lock placed after every time giving the food. After that end of the procedure, now we have to fix that is a cannula at the end of the tube to give the food along with the cannula. There is two cannulas here. There is one cannula is for giving the food, that is a large sized cannulas. Now again you can see that is a mushroom catheter tip is you can visualize through the OGD scope. That is after flushing with the liquid, that is liquid is come out through the mushroom catheter tip very nicely. These two patterns is checked. Now we can place the cannula. Now again there is a two cannulas there. One cannula for giving the food, another cannula for after giving the we have to plus the tube with the saline every times. This is very much important. Now we can easily visualize the flushing of saline with tubes. After that we have to suck out the air because intensely we have inflating the stomach with the air. Now after the procedure over, now slowly come out the OGD tube along with the sucking of all the air. This will prevent the floating of stomach. This is end of the procedure. Now this is the procedure over. Now slowly come out in a OGD scope through the mouth very nicely. Now we completely done PEC procedure. Thank you for watching. Thank you.